Good morning. Today we're taking an important step to protect families across San Diego County. Right now, our community is facing a significant challenge. Washington has made deliberate policy choices, passing a budget that cuts taxes for billionaires and massively expands ICE funding, paid for by slashing the social safety net that families rely upon. So now we in San Diego County are facing the consequences. Our county alone is anticipated to be needing to cover $300 million in yearly impact from these federal funding cuts and restrictions. Again, the impact to San Diego County of these federal budget cuts is anticipated to be $300 million annually. Hundreds of thousands of San Diegans are at risk of losing food assistance. Some have already lost basic food assistance daily. Seniors are struggling to afford groceries. Parents are worried about their kids disappearing or about themselves disappearing. And nonprofits across our region are being asked to do more and more with fewer and fewer resources. That is the reality of the cuts that we're facing today. But local communities do not have the luxury of walking away when problems hit. When Washington makes decisions that hurt working families, counties like San Diego are left holding the responsibility. So we are stepping up. Last November, the Board of Supervisors approved my proposal to establish the Partnership to Protect San Diegans. This is a unique, groundbreaking collaboration between the county and the San Diego Foundation designed to stabilize essential services during this period of federal funding cuts. So today, with the signing of this Memorandum of Understanding, we are officially putting our partnership into action. Let me take a couple moments to explain how this works. The county contracts with nonprofit organizations across our region to deliver essential services. This includes food assistance, behavioral health care, domestic violence shelters, youth programs, and services for seniors and people with disabilities. These grassroots organizations are the backbone of our community safety net. So this year, we were able to identify 67 nonprofit contracts that are especially crucial, as federal funding cuts ripple through our system. Through this partnership, the San Diego Foundation and their partners will cover half the cost of those contracts. This means the foundation will be contributing $8 million and the county will be contributing $8 million. So together that preserves $16 million in essential services that otherwise would be on the chopping block this fiscal year. Because the foundation is sharing the cost, the county is then able to free up roughly $8 million in local funding during this difficult budget year. So I am so incredibly grateful to the leadership of the San Diego Foundation and the foundation's partners in helping us as a county come up with $8 million more to meet the demand for food assistance and other critical social safety net services as Washington deepens cuts to the region. The county is investing $4 million into the San Diego Unity Fund, which the foundation created to respond to federal cuts. And then our philanthropic community is matching that contribution, which generates $8 million for additional support for food, housing, and healthcare programs. This is helping to stabilize our county budget and protect essential services as we navigate the uncertainty ahead. The Partnership to Protect San Diegans protects critical services, strengthens our 67 community nonprofits who deliver these services, and gives our county some breathing room. This kind of partnership and collaboration across government and philanthropy is what effective local leadership looks like. When Washington creates chaos and instability designed to tear us apart, local communities must come together to organize solutions, to bring partners into alignment, and protect the people we serve. So I'd like to thank the San Diego Foundation and our entire philanthropic community for stepping forward as partners in this effort. San Diego has long been the type of community where people come together to solve problems, And this partnership to protect San Diegans shows what's possible when government and philanthropy work together to protect the services families rely upon. Our message is simple. Even when Washington cuts our safety net, San Diego County will not abandon the families who rely upon it. Thank you. It is now my pleasure to introduce Mark Stewart, President and CEO of the San Diego Foundation.
Thank you, Supervisor Lawson-Remer, and thank you to the County and Board of Supervisors for your leadership and partnership. For more than 50 years, San Diego Foundation has served our region, mobilizing private philanthropy to strengthen communities and respond when challenges emerge. Last fall, when we began to see the potential scale of federal funding and eligibility changes, up to $300 million affecting San Diego programs, we knew essential services and the nonprofit organizations that provide them would come under pressure. So last September, we launched the San Diego Unity Fund with partners including the Prebys Foundation, Price Philanthropies, and the Price family. The San Diego Unity Fund was created as a rapid response effort to support food assistance, health care, housing support, and other core safety net programs that families rely on every single day. Since launching, the Unity Fund has raised more than $32 million and granted or committed more than $29 million to over 100 local nonprofits across the region. These funds translate directly into reliable services that are needed now, such as keeping people in their homes, safe shelter for expected parents in crisis, healthy meals delivered to low-income seniors, dental care for uninsured individuals and families, and detox beds available when somebody is ready to take that first step towards recovery. In short, the San Diego Unity Fund is sustaining many of the critical services that make up our region's safety net. Philanthropy can move quickly and flexibly, but it cannot shoulder systemic funding shifts this large alone. That's why the county's leadership in establishing the Partnership to Protect San Diegans is so important. The Board of Supervisors recognized early on that protecting essential services would require bold action and cross-sector collaboration, and we deeply appreciate their leadership. This alignment between public investment and private philanthropy strengthens programs already serving thousands of residents and helps support their stability during times of uncertainty. San Diego Foundation is deeply grateful to the donors who have stepped forward to support the Unity Fund. Their generosity, combined with the county's commitment, strengthens the network of care that supports thousands of residents every single day. This kind of collaboration reflects something special about our region. We're fortunate to live in a place where people come together. That's what we do in San Diego County when our community needs it most. Today, we reflect on that spirit once again, public-private partnership and leadership aligned to support our neighbors. We're honored to stand with the County of San Diego. Thank you.
Now we will hear from Dr. Elizabeth Hernandez, Deputy Chief Administrative Officer for the county's Health and Human Services Agency.
Thank you. Thank you, Chair Lawson-Remer. Good morning, everyone. The County Health and Human Services Agency is ground zero for this type of work. This type of work that the Partnership to Protect San Diego and the Unity Fund were designed to support. As the interim Deputy Chief Administrative Officer for Health and Human Services Agency, I am here to champion these efforts and actively support our collective success. The very contractors being supported are HHSA's partners in serving 1.3 million San Diegans each year. We are all joined on a common mission to help underserved communities and people throughout our region. It's important to note, people in our community are facing an uncertain economic climate. Rule changes coming to federally supported eligibility programs will make life tougher for many. HHSA's programs and services are here to help. They include the Aging and Independent Services, which protects older adults and people with disabilities. Behavioral health services, which treats residents through mental health and alcohol and other drug services. Child and family well-being, which delivers prevention and protection services through child and family-focused programs. Housing and community development services, which supports affordable housing and rental assistance for low-income individuals. Public health services, which promotes health and wellness, healthy behaviors, and equitable access to quality care. And self-sufficiency services, which connects children, adults, and seniors to federal and state services to meet basic needs. Each of these departments and their contractors will have a role in the success of both the Partnership to Protect San Diego and the Unity Fund. Together, I am confident that we can succeed and expand our ability to support the community. I want to close today by thanking the county departments behind these contracts and their amazing team members for the commitment to service they bring every day. I also want to offer a special thank you to Chair Lawson-Remer and the entire Board of Supervisors for their thoughtful and creative approach to this program. As we prepare for the changes ahead, I hold on to Gandhi's reminder: the best way to find yourself is to lose yourself in the service of others. Together, that is the work we do. That is who we are. Thank you.
Thank you all very much. Finally, I'd like to introduce Blanca Melendres, Executive Director of UC San Diego Center for Community Health, which operates the Mas Fresco Plus program supported by the San Diego Unity Fund.
Good morning, and thank you for being here today. I want to begin by thanking our Board of Supervisors, the County of San Diego, and the San Diego Foundation for sustaining and supporting Mas Fresco Plus since 2022. This program is a result of years of advocacy and collaboration with the American Heart Association, the San Diego County Childhood Obesity Initiative, and the Community Council. And we have two representatives with us here today, Joyce and David. Our local farms, our community clinics, and many community-based organizations that decided to come together and look at food insecurity and chronic disease prevention through food as medicine programs. At UC San Diego, we operate the Mas Fresco Plus program. It's a food as medicine produce prescription program that helps families in need have access to fresh, locally grown produce through produce boxes delivered directly at their homes. And this program is looking at food insecurity not just as a social issue, but as a health condition that needs to be screened for, it needs to be treated, and it needs to be diagnosed. Since 2022, the program has supported over 4,000 households. We've delivered over 68,000 locally grown produce boxes. We've distributed more than $2 million in nutrition incentives, and collectively, the economic impact is about $3.9 million. But the story of this program isn't just the numbers. It's the stories that we hear from the families. Recently, we heard from two grandparents who suddenly found themselves raising their 5 grandchildren after their daughter passed away. For years, most of what the children knew was canned food, and then they joined Mas Fresco Plus, and for an entire year, they had the opportunity to try fruits and vegetables that they've never had before, to eat salads and make smoothies, and make this opportunity, they say they treated it as a celebration every 2 weeks. And families like this are at the heart of the Mas Fresco Plus program. This includes seniors who are struggling to afford healthy food. These are families that are caring for loved ones that are suffering from serious illnesses, such as cancer. These are immigrant families that are adapting to a new country. And these are parents, many of them who also work and are trying their best to make sure that their children don't go hungry and have a healthy life. And the reality is that more than 800,000 residents in our county are considered to be suffering from nutrition insecurity. Of those, 100,000 of them are children. Families across our county are asking for this program to continue to grow and to reach more families, and that's only happening because of this partnership between the county and the San Diego Foundation. And we know that when families have access to fresh, healthy food, we are preventing chronic diseases, but we're also investing in healthy families. We are supporting the environment through supporting our local farms, and we're also supporting our local economy. Thank you.
Okay, thank you all very much. Speakers will be available for one-on-one interviews. And first, I'd like to invite our partners and members of the press to join us at the table, where Mark Stewart and I will sign the Memorandum of Understanding launching this partnership. Thank you all.